As Christmas time becomes more um, disease ridden with the COVID-19 virus, I become more and more concerned about my friends and family and other people in the United States as I see the numbers go up as far as the death count every day, as far as the number of people who are infected every day. And this week is the last week before we enter. The schools are out for the holiday season in most states in the United States, and they definitely will be out by next Wednesday in most states. So I just wanted to take a chance or take an opportunity to talk about some of the things that they have on the Centers for Disease Control website that we should be doing during the holidays, during this COVID-19 season. I've had at least 4 to 5 or 6 people that I've come in contact with via Zoom this week or have heard about that have been diagnosed with COVID-19. As I was also diagnosed with COVID-19 several weeks ago, and I have no idea how I contracted it, although I use all precautions that are needed. So we need to be especially safe because sometimes, even though we follow all of the guidelines, we still can contract the disease for whatever reason that we may not know of. So I just wanted to take some time to go over some of the holiday precautions and some of the statistics from the CDC website that we need to take into consideration during this holiday season. So as we look at the cases just in the last 7 days, we have had 1,494,770 cases in the last 7 days during this last week. And as cases, hospitalizations, and deaths continue to increase across the United States, the safest way to celebrate the winter holidays is to celebrate at home with people that you live with. Not people that are your close family or your extended family that you may not live with, that may be in the same county or the same city that you're in, but the people that are in your own home. That is what we are doing this Christmas holiday season, just to stay safe. I work in a field where on some occasions I have to come into people directly for treatment, as do my husband and in our family. And so we know that that is a risk, but we try to eliminate that risk as much as possible. So gatherings with family and friends who do not live with you can increase the chances of getting or spreading COVID-19 or the flu, which is also going to be prevalent during this holiday season. So the COVID-19 pandemic has been stressful, I know, and isolating for many people. And gatherings during the upcoming holiday can be an opportunity to reconnect with our families and our friends. And this holiday season, consider how your holiday plans can be modified to reduce the spread of COVID-19, to keep your friends, your family, and your communities healthy and safe. The CDC offers lots of considerations to slow the spread of COVID-19 during small gatherings, and these considerations are meant to be to supplement, not replace, any state, local, territorial, tribal, health, and safety laws, rules, regulations with which all gatherings must comply. Now, I know that the vaccine has been given to many healthcare workers this week, but that is no reason not to wear your mask, not to wash your hands, and not to stay 6 feet and have social distancing. Those things still apply even though people are getting vaccinations. Considerations for small gatherings of family and friends. Celebrating virtually or with members of your own household who are consistently taking measures to reduce the spread of COVID-19 poses the lowest risk for spread. Your household is anyone who currently lives and shares common spaces in your housing unit, such as your house or your apartment. I have 4 people that live with me in my house. Those are the people that I would normally come in contact with. Now, this can include family members as well as roommates or people who are unrelated to you. My kids were off in college, so up until recently, so that meant their roommates that they were in contact with, those were their close family people that they came in contact with on a regular basis, and they have to quarantine together. So people who do not currently live in your house unit, such as college students who are returning home from school, like I said, for the holidays, should be considered part of a different household, unless they are quarantining prior to and receiving and getting tested prior to coming back to your house. And I have linked some testing sites on my Facebook page, on my Instagram page, on our facility page, so it will make it easy for you to find locations within your area to get those testing done. So in-person gatherings that bring together family members or friends from different households, including college students returning home, pose varying levels of risk because you don't know where those people have been. So organizers and attendees of larger events should consider the risk of virus spread based on event size, like the number of attendees and other factors, and take steps to reduce the possibility of infection as outlined by the Centers for Disease, the CDC.org. So several factors can contribute to the risk of getting and spreading COVID-19 at small in-person gatherings, and they can be 8-10 people, and you can still have that risk of getting COVID-19. So in combination, these factors will create various amounts of risk. So community levels of COVID-19. Know what your community levels of COVID-19 are. High or increasing levels of COVID-19 cases in the gathering location, as well as in the areas where attendees are coming from, increase the risk of infection and spread among attendees, and that includes COVID-19 and the flu. So family and friends should consider the number of COVID-19 cases in their community and in the community where they plan to celebrate when deciding whether to host or attend a gathering. So information on the number of cases in an area can often be found on the local health department website, on the CDC's website. You can also Google COVID-19 cases in your area and come up with lots of different places where you can find out that information. It's also county data or parish data. So also consider exposure during travel, such as going to airports, bus stations, train stations, public transport, gas stations, and rest stops. All places travelers can be exposed to the virus in the air and on surfaces. So I was recently in an airport because I had to travel to a relative's funeral. So that posed a risk for me to get COVID-19. So I knew that I was going to have that risk. So I had to quarantine myself and stay away from my family members after I came back. And I had to get tested for COVID-19. So think about the location of the gathering that you're going to. Indoor gatherings, especially those with poor ventilation, and we're going to have gatherings with poor ventilation in the wintertime because it's cold outside, and most people tend to commute inside of indoor spaces. So, for example, small enclosed spaces with no outside air pose more risk than outdoor gatherings. Now, I have gone to some outdoor places like, if you're going to a farmer's market or something like that to pick up produce. Those are outdoor gatherings. Just make sure that you can go on a day that they are less crowded than other days. The weekends tend to be the most crowded during those in those markets. So try going during the week, during the day, if you're able to. Now, during duration of the gathering is also important. Gatherings that last longer pose more risk than shorter gatherings. So being within 6 feet of someone who has COVID-19 for a cumulative total of 15 minutes or more greatly increases the risk of becoming sick and requires quarantining. Think about the number and crowding of people at the gathering. Gatherings with more people pose more risk than gatherings with fewer people. The CDC does not have a limit or recommend a specific number of attendees for gatherings, but the size of a holiday gathering should be determined based on the ability of attendees from different households to stay 6 feet or 2 arms lengths apart. Wear masks, wash your hands, and follow state and local, territorial, and tribal health and safety laws and regulations. Now, before attendees, behaviors of attendees prior to the gathering. So know who you're inviting into your home or into your gathering. Individuals who do not consistently adhere to social distancing, and we know who those people are, staying at least 6 feet apart, mask wearing, hand washing, and other prevention behaviors pose more risk to those who consistently practice those safety measures. And like I said, we know who those people are. Behaviors of attendees during the gathering. Gatherings with more safety measures in place, such as wearing of masks, social distancing, hand washing, they pose less risk than gatherings where fewer or no preventive measures are being implemented. So the use of alcohol and drugs during a gathering may alter your judgment and make it more difficult to practice COVID-19 safety measures, and that is just a fact. You also need to take in consideration the people that should not attend in-person holiday gatherings. Those are the people that are people with or exposed to COVID-19. They don't need to attend social holiday gatherings. Now, there are probably people that know that they have COVID-19 and that will attend the gathering anyway if they don't feel sick or look sick. So you may not know that information, but if you do, those people should not go. And if you do know that you have COVID-19, then you should not be going either. So these people do not need to be going. If you know you have been diagnosed with COVID-19 or have met the criteria for when it is safe to be around people, you should not go around people if you do not know that you are safe to be around others. If you know you have symptoms of COVID-19, you do not need to be around others. If you are waiting for COVID-19 viral testing results, you do not need to be around others. If you have been exposed to someone with COVID-19 in the last 14 days, you do not need to be around others. If you are at increased risk of severe illness from COVID-19 and you have those comorbid conditions, you do not need to be around others. Do not host or attend gatherings with anyone who has COVID-19 or has been exposed to someone with COVID-19 in the last 14 days. Now, they are changing the 14-day period, or at least considering it, but right now they're still recommending 10 to 14 days. So people at increased risk for severe illness, let's talk about those. If you are an older adult or a person with certain medical conditions who is at increased risk or severe illness from COVID-19, or live or work with someone at increased risk of severe illness, you should avoid in-person gatherings with people who do not live in your household. I'm going to say that again. You should avoid in-person gatherings with people who do not live in your household. Now, if you are have considerations for attending or hosting a small gathering, think about these things. I'm going to show you some general considerations for hosting a gathering that brings together people from different households. Guests should be aware of these considerations and ask their hosts what mitigation measures will be in place during the gathering, and hosts should consider these items. Check for the COVID-19 infection rates in your area where attendees live on state, local, and territorial or tribal health department websites or on the CDC's website. Based on the current status of the pandemic, consider if it is safe to hold or attend the gatherings on the proposed date. Limit the number of attendees as much as possible to allow people from different households to remain at least 6 feet apart at all times. Guests should avoid direct contact, including handshakes and hugs with others not from your household. If you have to, and I have done this in our office and in our home, you should space your furniture out where people are not where they don't tend to want to sit with a person that is closer than 6 feet apart. Spread out those chairs, remove those couches if you're able to, remove those love seats if you're able to. That encourages people to sit closer together. That is one way that I have controlled the way that people are seated in our household. Spread the furniture out. Especially the seating arrangements, spread them out where people are at least 6 feet apart. Hold outdoor rather than indoor gatherings as much as possible. Even outdoors requires guests to wear masks when not eating or drinking. So some places in the north are not able to have gatherings outdoors because it's too cold. But if you're in a climate such as Southern California, Texas, wherever you may have a more of an opportunity to have those gatherings outdoors. Avoid holding gatherings in crowded, poorly ventilated spaces with persons who are not in your household. Increase ventilation by opening windows and doors to the extent that is safe and feasible based on the weather, or by placing central air and heating on continuous circulation. You can also buy different filters that will filter the air in your home or in your office or in the place that you are gathering to provide additional safety measures. You can also use the CDC's information on cleaning and disinfecting your home. I will put that information in the box below. So winter weather can be cold and wet and unpredictable. So inclement weather makes it difficult to increase ventilation by opening windows or to hold an event outdoors. If setting up outdoor seating under a pop-up open air tent type situation, ensure guests are still seated with physical distancing in mind. Enclosed four-wall tents will have less air circulation than open air tents. If outdoor temperature or weather forces you to put up tents sidewalls, consider leaving one or more sides open or rolling up the bottom 12 inches of each sidewall to enhance ventilation while still providing, somewhat of a windbreak. Require guests to wear a mask. This should be something that doesn't have to be said anymore, but sometimes I feel like we still have to say it. At gatherings, that should include persons of different households. Everyone should always wear a mask that covers both their mouth and their nose, except when eating or drinking. You can even use a straw with your mask if you are drinking certain drinks. So try that as well. It's also important to stay at least 6 feet apart from people who are not in your household at all times. Encourage guests to avoid singing or shouting, especially indoors. Keep music levels down so people don't have to shout or speak loudly to be heard. Encourage attendees to wash their hands often with soap and water for at least 20 seconds. If soap and water are not readily available, use hand sanitizer that contains at least 60% alcohol. Now with the kids that I work with, I have them sing the alphabet song to its fullest, not really fast, and so that gives them about 60 seconds of hand washing or 60 seconds of letting the hand sanitizer rub on their hands. So make sure. That's a childlike thing, but if you have to, in your head, sing the alphabet song. Provide guest information about any COVID-19 safety guidelines and steps that will be in place at the gathering to prevent the spread of the virus. We have safety guidelines that we both use at home and that we use at the office. Far as removing your shoes before you come in, taking your temperature before you come in, at the office signing a release that gives us information about where you've been, if you've been feeling ill, so forth and so on. Provide or encourage attendees to bring supplies to help everyone stay healthy. This includes extra masks. Do not share a swap mask, though. Hand sanitizer that contains at least 60% alcohol and tissues. Stock bathrooms with enough hand soap and single-use towels. Now, I always carry at least 5 to 6 masks in my purse. Sometimes I buy those cheap masks that are thin, just in case someone that I come in contact with that I don't feel comfortable with not having a mask on, and I can offer a mask. Or you can buy the disposable mask, where you can always offer someone a mask if you don't feel comfortable with them being around you without a mask. You need to clean and disinfect commonly touched surfaces and any shared items between use when feasible. I bought one of the air guns that mist. The misters that mist around to disinfect. If you're able to do that, you can do that. Use touchless garbage cans if available. I have those in my home where you can just wave your hand on top, or you can push the pedal at the bottom, so you don't have to necessarily touch the garbage can. Use gloves for removing garbage bags or handling disposing of trash, and wash your hands after you remove the gloves. A lot of people don't think if you use gloves you have to wash your hands after you use them. You should wash your hands before and after you use gloves. Plan ahead and ask guests to avoid contact with people outside their household for 14 days before the gathering. They don't have to do it, but you can definitely ask. Treat pets as you would other human family members. Do not let pets interact with people outside your household, or if you have COVID-19, do not interact with your pet until you know that you have tested negative. These are just some of the items that are covered on the CDC's website. There are other items that I did not cover. I will put the link below, such as food and drinks at a small holiday gathering, travel and overnight stays. You can also look that up on the CDC's website. Also, considerations for staying overnight or hosting overnight guests. Tips for staying overnight or hosting overnight guests, things that you should do before that happens. Make sure you get your flu shot. Let me say that again. Make sure that you get your flu shot this season. And know your steps to take if exposed to COVID-19 during a holiday gathering. The best way to protect yourself and others is to stay home for 14 days if you think you've been exposed to someone who has COVID-19. Stay away from others, especially people who are at increased risk for severe illness from COVID-19. Watch your fever, 100.4 or higher. Although you do not, some people do not exhibit fevers with COVID-19. If you're coughing, have shortness of breath, or the symptoms of COVID-19, consider getting tested for COVID-19. Even if you test negative for COVID-19 or feel healthy, you should still stay at home and quarantine for 14 days after your last contact with a person who has been tested positive for COVID-19. This is because symptoms may appear 2 to 14 days after exposure to the virus, and some infected people never have symptoms but are still contagious. Do not travel until 14 days after your last possible exposure. Now, if you can't stay completely away from others during that 14-day period, stay at least 6 feet apart from other people. Wear your mask that covers both your mouth and your nose when you're around other people or animals. Wash your hands often with soap and water for at least 20 seconds. Monitor yourself and household members for symptoms of COVID-19 and get information about COVID-19 testing if you feel sick. COVID-19 testing is not as nearly as hard to find if you as it was back in March and April. You may have to wait in line, but isn't it worth not risking your family, friends, and other people that are around you with getting COVID-19? But definitely consider those holiday celebrations. If you're going to have them safely, but also I would advise you just not to have them and have them with the people that are already in your house that you have already been so-called self-quarantining with. If you have any questions, leave them in the comment box. If you like this video, please give it a thumbs up and hit subscribe. Thank you and have a great day.